So, acupuncturists come across a large spectrum of problems and everyday conditions, and for this reason we get to know a lot more about our patients than perhaps their GPs or even their family and friends, and so they come to us and will often come before they would consider going to a GP or to a consultant. So it's one of the reasons why we need to be really up on our knowledge of what red flags are. And often the severity of those symptoms will have no relation to the severity of the disease that they have. And so some may present with extreme pain, and may, appear very ill and quite a mild problem, and others may have very, very mild symptoms, or even something they've not even noticed themselves. But that could be something that you can spot and point out and hopefully refer on. And the red flags are symptoms that you can gain from a patient's medical history, also by the clinical examination, and it can be a red flag is linked with a high risk of having serious underlying pathology, something like an infection, cancer, a fracture, and by diagnosing a red flag or by spotting a red flag, you're not performing any diagnostic tests, and you're not really there to predict the diagnosis or the prognosis, but to refer on to someone that can give more information, and hopefully clarify things a bit more. So one thing I'd just like to point out is that all of this that we're going to discuss today is from a piece of work that was done back in 2008 and has been updated, and it's based on the Red Flags for Complementary Therapists book. And I can't find it. I had the book with me just a moment ago. Here it is. I just wanted to show it to you. So it's a lot of the information that I'm giving you today is the Complementary Therapist Guide to Red Flags. Can you see that? Because I'm blurred, aren't I? So it's by Claire Stevenson, and we were given many years ago permission to use this information, and we have drafted and provided a succinct guide specific to acupuncturists from that book, the Claire Stevenson Complementary Therapist Guide to Red Flags and Referrals. So if you do want to do any further reading, or if you want to clarify anything that we've been talking about today, please go to that or email me, but otherwise that book itself will give you a lot of information. So why do we refer on? We can refer on simply for medical treatment. Something's worrying, if they need something treating, then that we can't treat, then that's why we're referring on. Obviously to investigate and exclude serious diseases, and as I said earlier, we can find out a lot more about a patient than perhaps the GP, and they're often a lot more honest with us than they are with medical professionals. So those we can spot the need for those investigations, and have suspect certain more serious diseases. Obviously, if we feel that we're sure of a diagnosis, then it can be quite useful to get that confirmed, because then the patient can get the correct advice and management of complex conditions, and that's not always within our abilities as a practice. So we're going to remind ourselves of quite a lot of red flags today, and this is going to be the key that we use. So we refer non-urgently, and that, sorry, let me just find my notes. A non-urgent referral is, we would like the patient to be seen within a week by, an NHS professional. A lot of the non-urgent referrals could be bumped up if the patient is particularly anxious, if the worry about the condition is making the patient unwell. Then you can take that up to more of an urgent or a high priority, if you feel that is necessary. And normally, if you're going to make a non-urgent referral, you can type a letter if you want to give that extra information to the medical professional, so the GP or the consultant. And if you want a bit more information on that, then I highly recommend on how to write that letter and what to put into those letters. I highly recommend having a look at the information that we've produced at the BAcC, which I am going to try and get into e-news next week when we announce the next webinar. So or refer back to Claire Stevenson's. There's a lot of information in there. The next one is to refer as a high priority. And obviously a lot of these are one or another, and that will very much depend on the particular patient and how they're presenting at the time. But a high priority, it means that you need the patient really needs to be seen the same day. I realise there are lots of practical problems with that, and that may involve having to go to a walk-in centre or accident and emergency, because not all GPs are available that day for emergency appointments. But the thing to do would be to get the patient to ring their, hang on, let me try, and I think I've gone too far. The thing would be to, here we go. The thing would be to get the patient to ring their GP to explain their symptoms and then take advice on where to go from them. Hopefully they will see them in-house, and there won't be need for going somewhere that could create a lot more anxiety. And then the urgent referrals, so the one shown in red, number 3, it's really when the patient requires immediate attention. So that could even involve calling paramedics, or if they've got transport or there's an ability for them to get to see someone clinic, then that could be the answer as well. But often that will involve getting paramedics to the scene or calling an on-call doctor. So there are certain times when things might, be one or the other, and really it's down to your own professional judgment in that case, which call to make. But often it's often judged again by how the patient is feeling about the particular problem as well. So you need to take all of those things into account when deciding upon what to do with a patient presenting with a red flag. So one question we do get asked is is it okay if you're referring someone as a high priority or urgently, can you still give them acupuncture? So as long as that doesn't delay their treatment, if you're waiting for someone to come, then yes, and as long as there are not any increased risks of infection, or the person's, you suspect they're severely immunocompromised, or there's an increased risk of bleeding, then you can treat. And again, this has to be down to professional judgment, and your experience, and confidence in what you're doing. But equally, what you don't want to do is have someone blame the acupuncture for something that you've already seen presenting. So it's a difficult call to make, but it certainly doesn't mean they can't have acupuncture. Absolutely, anyway. Okay, then, so we're going to start by looking at the red flags around cancer, and that can be indicative of cancer. So progressive symptoms, so somebody presenting with a fever, poor appetite, weight loss, sweats, specifically night sweats is very much, and these sort of symptoms will gradually worsen, and they don't tend to fluctuate too much in intensity, although, as we know, everybody's differently. This can be really sort of the first two levels of urgency: non-urgent, so within a week; high priority if the person seems very unwell, and you could even, if it seems as though it's a very, very rapidly progressing problem, or the patient is very, very anxious, then definitely, send them off to get seen that day, because that will just make the problems worse. An unexplained lump, a hard, painless or fixed or irregular lump, again, that's pretty self-explanatory, and depending on whether on how that's presenting, and whether the patient is very anxious, or whether within your knowledge that particular area has been coming on for a long time, or it's all very different as to whether you refer urgently or non-urgently, but certainly get the patient to speak to the GP as soon as possible if you've found a hard, irregular, fixed, painless lump. There can be unexplained bleeding, either from the surface of the skin, or it could be coming from the bowel, the bladder, or the uterus. So it could be unexplained vaginal bleeding, or in the urine, or the feces, and that, bleeding can happen because of, obviously, the cancer may be provoking a surface tumor, and it may be weakening the skin, and or causing blockages. So that can often happen sort of the breast, the skin, the lung, the mouth, the stomach, the bowel, the bladder, or the uterus, for unexplained bleeding, and that could be where that cancer is, it could be manifesting. The next one, features of bone marrow failure. So they can be, bruising, bleeding, and pinpoint bruising, which can appear like a rash or flat purplish spots. And that can be a real sort of indicative sign of low platelet count. So often this could be secondary cancer of the blood cells, which can infiltrate. Oh, I keep doing this, don't I? Go back. Cancer. Sorry, I've got a nervous finger, it seems, and I keep pressing it, and it keeps on going on. So, and then the next one would be enlarged lymph nodes. I think one we've often, you may have come across in life as well as in clinic. So, and usually that would be a lymph node that's greater than 1 centimeter, but they're often very painless, and with no other obvious causes. So you can get an enlarged lymph nodes with things like glandular fever, and that would be far less urgent. But if it's an enlarged lymph node that is painless, often found in the cervical region, in the armpits, or in the groin, and they can manifest as impalpable masses of soft tissue, and they'll become enlarged. and that's when there's a active fighting infection, or they've been infiltrated by tumour cells. And if a number of them are enlarged, then that could be more of a generalized infection, such as glandular fever or HIV and AIDS, which can be another important cause of widespread lymph node enlargement. And that if multiple lymph nodes are found, I think it's always best to refer for diagnosis as a high priority in that stage, because the patient can appear very unwell. Okay, if there's a single marked enlarged lymph node greater than 2 centimeters, then that can usually lead to cancerous infiltration. Can usually be indicative of cancerous infiltration, and it's usually firm and sort of quite grossly enlarged, but again, it may be painless, and that could be a sign of lymphoma. So the next one is the painless abdominal swelling, and this would just be due to fluid accumulation, and that's often as a result of colon cancer, stomach cancer, ovarian cancer, can lead to the fluid within the abdominal cavity. And again, it may be painless, and it's often not a very good prognosis at that stage, and generally the patient will already know that there is a problem. They will always already know that there is a problem in that, but it's definitely a sign that things are progressing, and they need to go back and see the specialist. So the next one, red flags of infectious diseases. I've just sort of thought what a pleasant evening this is for us all talking about these things. So the next one is red flags of infectious diseases. So there are, this is particularly worrying in vulnerable groups. So those that are elderly, pregnant ladies, immunocompromised, and infants. And you can see the list there of things that particularly will usually be present when there's an infectious disease. So the fever, confusion, diarrhea, vomiting, lots of inflammation, and often a yellowy discharge. So in infants, this can become serious very quickly, so they would need to be seen within the day, and it can lead to sort of high fever and dehydration. And of course, infants are particularly susceptible to this, and an increased risk of convulsions and circulatory collapse. But obviously, a fever is not uncommon in infants. So it usually is not serious. It's just when they present with those other issues as well, and especially if they're not responding to treatment. The elderly. Hang on, am I at the elderly yet? Oh, it's not even on there, is it? So yes, within the elderly, infections can take hold very rapidly. So again, if some of those previous symptoms are there, and you suspect an infectious disease, it can be quite urgent for the elderly as well. So they would again need to be seen within the day. And again, the immunocompromised and in pregnancy, in pregnancy particularly, this could result in direct damage to the fetus, and lead to miscarriage, or even to the onset of early labour. So again, the patient will, if you suspect infectious diseases, then they'll need to be seen within the day. And I think the obvious one is if somebody's been traveling as well. You know, there's an awful lot. Obviously today we have another infectious disease that we need to be very aware of with COVID, but we've not really covered that in this particular webinar because really, I think we've had those drummed into us enough recently, and we very much know the signs, and are pre-screening people. However, there are lots of infectious diseases that we're not pre-screening for, so they may come into clinic showing these signs and symptoms, and you'll need to refer them on, usually urgently, within infectious diseases. Okay, so red flags for diseases of the mouth. One is persistent oral thrush. Now, there are lots of situations when oral thrush is seen as quite normal, often in a newborn and in children. But if there is somebody presenting with this, they should always, if they haven't, go and see a GP about it, because there could be an underlying cause that has not been diagnosed. And a lot of causes can include the use of corticosteroids or asthma inhalers, diabetes, immunodeficiency, so HIV and AIDS, and cancer. So you really need to get that diagnosed by a GP. And often at the elderly, if they have dentures, that can, predispose to oral thrush as well. However, again, it's something that does need to be looked at by a GP to just rule some things out. Persistent painless white plaque. So again, this can indicate a change which signifies an increased risk of mouth cancer. It's often common in smoke. Well, it's more common in smokers and those that drink a lot of alcohol, and it can be associated with HIV and AIDS. But really, early treatment is very much recommended, particularly if it's a predisposition to invasive mouth cancer. So referral is recommended within a week to rule out anything worrying. So there's also the painless enlargement of the salivary gland. So this could happen over a few weeks, and it does need a referral. And it's most common in people over the age of 60, and that would be salivary gland cancer. So again, it's something that the patient would need to be seen within a week if they're presenting with that, and it's been happening over a few weeks or months. Again, it's one of those situations where they may come to you first, and it's been developing over a certain amount of time. And once they present with you, then that red flag is fully waived, really, and you need to refer them on. Again, as I said earlier, it doesn't mean you can't treat them. It doesn't mean that you won't be able to help them. It just means they have to go and really see a doctor sooner rather than later. A painful or painless enlargement of a salivary gland. This could just be something quite simple, a salivary gland stone or obstruction from dried secretions, and really they need to see a GP to check that is the case, and sometimes if it's persistent, they may need surgical removal of a stone, but maximise their hydration. So encourage them to drink, encourage them to salivate, and that could easily fix the problem. So if, and if that's the case, then referral isn't needed. It's just when it's quite persistent. Tender or inflamed gums or salivary glands, and again, this is if it's not responding to treatment within a few days, and it may be accompanied by fever or malaise, and these symptoms suggest maybe a dental abscess or infection of a salivary gland. So if it persists, it indicates a need for referral for antibiotic treatment. Because there is a risk of inflammatory damage to dental roots or salivary glands there. And persistent ulceration of the mouth, again, for more than 1 week, or if it's preventing hydration. So if it's stopping the person from drinking, especially a child. So it can mainly be caused by the herpes simplex virus, but if it is inhibiting drinking in a child, for instance, then they may need to be hospitalized if they're suffering from dehydration. And if if in a healthy adult, an otherwise healthy adult, it persists over 2 weeks, then it could suggest an underlying inflammatory condition, such as Crohn's disease or mouth cancer. And will require further investigation. Very rarely it can be a sign of bone marrow failure, and can be a result of a very low blood count. But as I say, that is quite rare. And again, you can refer on if there is a worry there. The red flags of the esophagus, so difficulty in swallowing, which is worse, particularly with solids, and particularly is progressive over a few days or weeks. Sensation and difficulty in swallowing, or a lump in the throat is common, and it may fluctuate with emotional stress. In this case, it may not be as worrying, and usually swallowing a food is still possible. However, if there's a physical obstruction in the esophagus, it could be a result of cancer or stricture, so scarring, and may be progressively difficult swallowing foodstuffs. So this could be accompanied by weight loss, and will need prompt referral. So depending upon the particular signs and symptoms, and the picture, it will need referring either urgently or for within the week. As a high priority or for within the week. Difficulty swallowing. This could also be associated with an enlarged lymph node, and could be the possibility of a malignant or inflammatory cause. So again, it could need referral within the week or even within the day if it's particularly marked. And if there's any problems swallowing associated with a pain in the chest, so right behind the sternum, and it can often be delayed. So you swallow, and then there is a delay, and then there is pain, and this suggests esophagitis or a structural damage to the esophagus. So a tear or a puncture by something like a fish bone. And if that doesn't settle within 24 hours, so it could just be very acute and wear off very quickly. But if it doesn't settle within 24 hours, then refer non-urgently, so within a week, unless the pain is very severe. And of course, in all sort of times where there is a complication, such as very severe pain or high anxiety, then we perhaps need to see a doctor more urgently. Okay, so next is diseases of the stomach, red flags. 5 days of severe diarrhea and vomiting, that's really in an otherwise healthy adult, but really if it's the elderly or infants, if it's for more than 24 hours, then that can in itself cause a problem. So it could be they need urgent medical attention straight away, if not, then within the day. If it is in a healthy adult, so previously with elderly and the infants, if it's within a healthy adult and it's more than 5 days, it definitely needs investigation of an infectious or an inflammatory cause. It could be something like food poisoning, and if that is suspected, food poisoning and dysentery, they are both notifiable diseases. So as well as referring on, you will need to notify the authorities of that. So diarrhea and vomiting, if it's associated with dehydration, again, that could be very, very urgent. And you know, those dehydration red flags, low blood pressure, dry mouth, concentrated urine, poor skin, turgor, confusion, then you need to refer as a high priority and urgently, particularly in infants and the elderly. As continuing to vomit will, you know, it sounds like it would already be quite unstable at that point. And in the infants and the elderly, that will just get worse very, very quickly. And again, that could also be a sign of food poisoning and dysentery, which in itself, in themselves, are notifiable diseases. So the next one would be if the patient is vomiting fresh or altered blood, and that to see it looks like a dark gravel or a coffee ground sort of look to it, and it's always a concern when there's blood in the vomit. If there's, well, I say always a concern, you can, you know, people can vomit and they may cause a slight tear. So you may get up to something like a tablespoon of blood, and that may just be from vomiting and causing a little bit of damage as the vomit occurs. But if it's more than a tablespoon of blood, then that needs to be referred, and it could be originating from the stomach, or the duodenum, and it could be a peptic ulcer, disease, or stomach cancer, and especially if so in those cases they need to be seen within the day. If there are any signs of shock, for instance, faintness, dizziness, low blood pressure, a high pulse rate, that's you know, that could be an indication of significant internal blood loss. So, you know, again, that 999, or to be seen immediately. The next one, projectile vomiting, if it's for more than 2 days. So a projectile vomit is one that appears really, really quickly, and you know, will be coming out at very high speed. It can suggest an obstruction to the outflow of the stomach, and it needs to be referred on, as there is a risk of loss of bloody of fluids and salts. And if this is a baby, they need to go to hospital straight away. So yes, it can be quite serious. Epigastric pain or dyspepsia, for the first time in somebody over 40, or for someone that hasn't been responding to treatment over 6 weeks, if they're below 40. So the pain from the stomach or duodenum, it typically radiates between REN 12 and REN 4. So it can be tender on palpation, and can be accompanied by acidity or fullness. So if in certain times, you can treat in these cases, and then if it doesn't, particularly in a healthy young adult, it doesn't refer, if it doesn't respond to treatment within 6 weeks, or if somebody is over 40, because that is when the risks of cancer is more common. Once they reach 40 and above, and it presents for the first time, then that might need referral as well. Again, usually to be seen within a week in this particular instance. Yeah, so there could be things like stomach cancer, peptic ulceration, and a medical, Western medical, we don't quite know how to say that. A GP needs to be consulted. So altered stools in the blood. Oh, sorry, altered blood in the stools. You'll have to excuse me. Altered blood in the stools. So the stools will normally look like tar, and can have quite an unusual metallic smell. Could also be a result of drinking a bit too much Guinness. But if this is, happening a little bit more than just after one night watching the rugby, then it can indicate sort of bleeding from the more proximal aspects of the digestive tract, including the stomach. So if it's apparent in the stools, and it's fairly significant, then they need to be sent straight away, or certainly within the day. And severe abdominal pain with collapse. This is also known as the acute abdomen, and the pain can be constant or it can come in waves. There's obviously often rigidity, and guarding and rebound tenderness. And if those are there, then this can be very serious. So if somebody isn't able to continue with their day-to-day activities, and almost collapses, really, it could just be, a benign cause. It could be IBS or dysmenorrhea, or ovulation pain. However, you need to leave it to your professional judgment, but really there's a good possibility it could be more serious, something like appendicitis, perforated ulcer, obstructed bowel. And if there's the colicky pain, so if it comes in waves, it can indicate obstruction of a viscus. And a good way of finding some answers here is to palpate, obviously. But if the pain is felt elsewhere in the abdomen, when you release from the palpation, it suggests inflammation or perforation of the viscus. So, red flags of the pancreas. What time are we on? So I know that this is going on, and I'm really aware that my voice is getting quite monotonous. So I'm going to carry on just for a little bit longer. But then I think what we'll do is we will switch off the recording and we shall have a discussion, because I think that would help us here. So red flags of the pancreas. Again, this manifests as the acute abdomen, and it can be very central and can radiate to the back, and be accompanied by vomiting and dehydration. So it's basically pancreatitis, and a serious inflammatory condition. It may develop for no obvious reason, but can be associated with high alcohol consumption or a gallbladder obstruction. This patient must not take any fluids or food by mouth and needs to be sent urgently if this is the case. Symptoms of chronic pancreatitis. So again, the central abdominal and back pain. This may be accompanied by things like weight loss, loose stools, and that can be coming on over weeks or months. It can be as a result of long-term alcohol abuse, so that would be a sign to look for that may accompany these signs. And it could be inherited, so it could be something that there is a family history of. So the scarred pancreas can generate deep chronic pain and lack of digestive enzymes. It can lead to the syndrome of malabsorption, and there is also a risk of diabetes. This needs to be referred either as a high priority or for within the week. Malabsorption syndrome. Okay, so that can be the loose, pale stools, malnutrition, weight loss, thin hair. And in children, this will present as a failure to thrive. It's usually as an inability to absorb the nutrients in the diet, and then the weight loss and mineral and vitamin deficiency will result from that. And the loose stools are there because there's unabsorbed fat just being sent straight out. And this is one of the main causes, chronic pancreatitis of malabsorption syndrome. So that will need to be seen either within the day, depending on all the whole picture, or within the week if it's presenting as fairly mild or non-urgent. Jaundice is the last one, a real sign of a disease of the pancreas. And so jaundice, I'm sure many of you know the signs and symptoms. However, I will tell you, seeing as I'm here, yellowish skin, the yellowish whites of the eyes. They've often got dark urine, pale stools, and itch can be a real sign as well. And it's usually as a result of a problem of the production of the bile by the liver, or it could be an obstruction to the outflow via the gallbladder into the duodenum. So pancreatic cancer may cause this, and jaundice always merits a referral for investigation, and usually within the week, unless there are other signs that are creating more of a worry. And still on jaundice, red flags of the liver. Again, this is a problem by production of bile by the liver, and the obstruction via the gallbladder. It could be a result of inflammation of the liver, so of hepatitis, and of liver cancer. And that can be a bacterial infection. But it could also be the result of negative effects of certain prescription medications, excessive alcohol intake, and again, as I said earlier, as with the pancreas, jaundice always is a reason to refer. Right hypochondriac pain under the ribs on the right. If that is accompanied with malaise for more than 3 days, that can suggest a liver or gallbladder pathology. It should definitely be considered for investigation, even if there's no jaundice and it's persisting for more than 3 days. But if there is jaundice there, then that definitely will need referral. The vomiting of fresh or altered blood, as we described earlier, it can be like gravel or coffee grounds, and it's always a concern. And again, if it's less than a tablespoon, it could be something just like a tear as a result of vomiting. But if there's more than a tablespoon, then that can be a sign of chronic liver disease. And this person could easily go into shock. So it needs to be handled as an emergency. Liver disease, it may remain stable for many months or years, but suddenly the patient might start to become quite unwell. They might start showing edema, bruising, confusion, and that's sort of an indication that liver disease is in itself progressing. So at this point, the liver is no longer able to perform its function of the manufacture of blood proteins and detoxification. So it will cause things like bruising, edema, and confusion, and this requires urgent medical management. So they will need to be seen that day by a GP or medical professional. So the next one, red flags of the gallbladder. Old one, jaundice again. And again, as we mentioned earlier, the jaundice results as a problem of production of the bile by the liver, or an obstruction, and that obstruction can be via the gallbladder. And that obstruction could be something such as a gallstone, which would normally be accompanied by severe colicky pain that comes in waves. It can also develop gradually, and if it's a gradual onset, it's usually by something like a tumour of the gallbladder or duct. And again, it will always, as always, jaundice is it merits referral, fairly high priority referral. Right hypochondriac pain, again, we spoke about it with the liver, but that's also could be a gallbladder pathology, and even in the absence of jaundice, it requires it can require a referral if it's been going on for more than 3 days and it's accompanied by malaise. And very, very intense hypochondriac pain with fever, vomiting, jaundice, the acute abdomen, so that as we described earlier. It could be that there are gallstones, and the gallbladder is becoming inflamed. So I would say this person needs to go see the GP, or it requires medical attention that day. And even more urgently, almost immediately, if it's particularly intense, because I think that can often result in collapse as well. I think I'm just going to do the small intestine and colon, and I think we're going to take a rest after that, and we'll go and I'll let you guys discuss things, and we'll chat, because I think this is all very intense today, with all of these wonderful red flags. Sorry, wonderful red flags, that's the wrong thing to say. All of the awful red flags. So the next one is red flags of the small intestine and colon, malabsorption syndrome, loose pale stools, malnutrition, weight loss, thin hair, dry skin, cracked lips, peeled tongue. That all is indicative of malabsorption syndrome, and it will present as a failure to thrive in children. We discussed this earlier as well, but this can result in the inability to absorb nutrients, leads to weight loss, vitamin and mineral deficiencies. The unabsorbed fat is obviously the loose stools, and this could also be a disease of the small intestine. It's most commonly celiac or Crohn's disease, and that can result in the malabsorption syndrome. But that person, if that's undiagnosed and untreated up to that point, will need to go to see a GP. Usually that day, depending on the severity, but could be up to a week, depending on how they're presenting there and then. Diarrhea, with mucus and gripey pain, usually if this is not responding to treatment within a week, it can suggest a serious episode of a bowel infection. It could be inflammatory bowel disease, again, Crohn's or ulcerative colitis, and both would need a prompt referral. The onset of severe abdominal pain with collapse, and that it could be constant pain, it could be the colicky pain coming in waves, and with that collapse, with that inability to continue the day-to-day activities, it could just be something benign like IBS, dysmenorrhea, ovulation pain, but it really could be something more sinister. So it could be something like appendicitis, perforated ulcer, obstructed bowel. There's a lot of things that could be, and it definitely, depending upon the severity of how they present there and then, needs to be seen there and then, going straight to A&E, or certainly within the day. And any episode of blood mixed with the stools. Oh, hang on, I've gone, sorry, excuse me. There we go, back to the any episode of the blood mixed in with the stools. As we said earlier, that could be diverticulitis, a bowel infection, inflammatory bowel disease, or it could be something like bowel cancer, and blood so this would be more blood within the stools, mixed with the stools. A patient may appear with blood dripping from the anus. Now that would normally be hemorrhoids or hemorrhoids or piles. So there's no need to refer that strictly straight away. Obviously if this is new and not been looked at already by a GP or specialist. An altered bowel habit lasting for over 3 weeks. Now, this is generally in people over 50 years. So at this point, by the time people reach 50, there's normally a predictable pattern of bowel movements. And if this pattern inexplicably is changed for 3 weeks or more, then that can be a warning sign of inflammatory bowel disease or cancer. So it's definitely needs to be considered for referral when the patient is over the age of 50, because it's a high risk of bowel cancer in that particular age group. Suspected dysentery or food poisoning. Again, as I said earlier, this is a notifiable disease, and any episode of diarrhea or vomiting in which food is suspected, or in which blood appears in the stools. So this could be as a result of a bacterial infection. It could manifest in profuse watery diarrhea, abdominal cramps, and blood in the stools. And then obviously food poisoning is a consequence of eating food which is contaminated with an infectious organism. And as I said earlier, they are both notifiable diseases, and will need urgent referral would need a referral within the week, unless the person is particularly very ill or suffering from severe dehydration. So the next one is a hernia, so a weakness in the abdomen wall in the region of the groin. The abdomen contents can bulge into a narrow necked passage, and that can be a weakness in the passageway, and that results in a hernia, and this can carry a risk of a loop of the bowel can become obstructed, and therefore there's a risk of strangulation of that portion of the bowel. So they may need surgical assessment. because there's a lot of complications there. If it's very, very acutely painful, then they need to see somebody straight away that day. Or if it's showing as less urgent, then they would need to. Anal discharge, I think always refer for a diagnosis if this is persistent, and if it's in a normally continent child, it could signify constipation with fecal overflow, and development problem of the bowel or emotional disturbance. So that's within a child. An anal discharge, it may be from rectal or anal cancer, and a fecal discharge may result from constipation with overflow of fecal fluid in an elderly person. But even so, it requires referral. If there's a lump felt in the anus, it could be a skin tag or anal warts, but it could also be anal carcinoma. So that needs to be diagnosed, especially if it's persistent for more than 2 weeks. And a painful lump in the anus could be a prolapsed hemorrhoid, which could be serious if the blood supply is pinched, and it could be an anal carcinoma. It needs referral for diagnosis if the pain is severe, and if it's a painless lump, then again it needs to be referred if it's going on for more than 2 weeks. But if it's a painful lump, it needs to be referred within the week, or even that day. And the last one of today's webinar, we're going to end on anal itch. And so this is basically if the patient presents with a short history of intense nocturnal anal itch, it could be a threadworm infection, which could be treated themselves. It could, if it's more of a prolonged history, it could be likely to be the result of hemorrhoids and skin tags. However, it could be a result of more serious conditions, and so it needs to be referred if it's not responding within 3 weeks. And that is the end of today's red flag webinar. We've just done over an hour, and I think that's probably long enough to discuss things like anal itching. And so I think what I'm going to do now is stop sharing my screen, and I'm going to ask Helen if she will stop recording, and then perhaps we could have a discussion. We can discuss people's own experiences, or if anybody has any questions, I shall endeavour to know the answer. So I'm going to stop sharing now.